What challenges exist in colorectal cancer gene therapy patient selection? Imagine trying to find the perfect key for a lock that keeps changing shape. That's similar to what scientists face when selecting patients for gene therapy in colorectal cancer. One of the biggest hurdles is tumor heterogeneity. Tumors in colorectal cancer are not all the same. They can have different genetic mutations even within the same tumor or between primary and metastatic sites. For example, about 23% of patients show different mutations in their primary tumor compared to their metastases. This makes it tricky to decide which genetic targets to focus on because testing just the primary tumor might miss important mutations present elsewhere. So, doctors need to consider whether to analyze the primary tumor, the metastases, or both, which adds complexity to patient selection. Another challenge is the tumor microenvironment, which is like the neighborhood surrounding the cancer cells. In metastatic sites like the liver, the environment can be dense with fibrous tissue that acts like a barrier, preventing gene therapy vectors or immune cells from reaching the cancer. Some types of metastases are more accessible than others, so understanding the characteristics of each patient's tumor environment is crucial for predicting whether gene therapy will work. Delivering gene therapy safely and effectively is also a major concern. The vectors used to carry genetic material into cells are often viral or non-viral. The challenge is to target only the cancer cells without affecting normal tissues, avoid immune reactions, and prevent unintended genetic changes. Achieving this balance is difficult, and current vector technology limits which patients are suitable candidates. For example, systemic delivery might be too risky or ineffective for some patients due to these safety concerns. Identifying the right genetic targets is another complex piece of the puzzle. To design effective gene therapy, clinicians need detailed molecular profiles of each patient's tumor. But colorectal cancer has many different mutation patterns, and our understanding of these pathways is still evolving. Resistance mechanisms can also develop, making it harder to choose the most promising targets. This personalized approach requires advanced diagnostics and validation, which are still being developed. Research limitations also play a role. Many gene therapies are still in early stages or preclinical trials. Because of the high costs and complexity, only a limited number of patients can participate in these studies. This scarcity of data makes it difficult to establish clear criteria for selecting patients who will benefit most, and it slows down the progress of making gene therapy a standard option. Finally, integrating gene therapy into existing treatment plans adds another layer of complexity. Patients often receive surgery, chemotherapy, or immunotherapy first, and figuring out when and how to add gene therapy requires careful planning. Doctors must consider prior treatments, overall health, and tumor burden to determine who is a good candidate. The timing and sequencing are still being researched, which influences patient eligibility. In summary, selecting patients for colorectal cancer gene therapy involves navigating tumor genetic diversity, overcoming barriers in the tumor environment, ensuring safe delivery methods, pinpointing the right genetic targets, dealing with limited research data, and coordinating with other treatments. Each of these challenges highlights the need for ongoing research, advanced diagnostics, and a personalized approach to improve outcomes and bring gene therapy closer to becoming a valuable option for more patients. Always remember, consulting with healthcare professionals is essential for tailored treatment decisions.